यो vishwam vidhadhati pati satatam samharayatyanjasa srishtva divyamahauschadischa vividhan durikarotyamayan vibhrano jalana chakasti bhuvane piyushapurnam ghatam Tam Dhanwantari rupa misha mamalam Vanda mahe shreyase Vanda mahe shreyase Vanda mahe shreyase Om Shanti Shanti Shanti. One other factor we need to also remember is the difference between Dashavida Pariksha and Ashtavida Pariksha. In Dashavida Pariksha, mostly we'll be doing questioning, which we also know that the three major forms of examination is Darshana, what we visualize or see, Sparshana, which means palpation or touching, and Prashna, which means asking questions or talking. Information that we're gaining from these three methods of examination that's then broken down to the Dashavida Pariksha or Ashtavida Pariksha. For Dashavida Pariksha, it's mostly through questioning, whereas Ashtavida Pariksha can require hands-on interaction with the patient. So that now you may not want to do hands-on stool examination or urine examination, but these are things that are tangible, the biological parameters that we can come across and we can examine. Okay? So in Ashtavida Pariksha, again, as I mentioned, these are biological parameters that we are examining, that we need to know. And what it is it's a byproduct of some of the normal functions of the body. So even though some of these are waste products, it gives us an idea as to how the body is moving. If a machine is working properly, then it has a normal, proper output. And if there's a change in that output, it indicates that there's some change in the process. So that's what we're really gaining, and we're really understanding how if there's a change in the normal process of the body, the normal physiology of the body, that shows an immediate indication in these 8 factors. And that's what we're going to figure out. If we see these changes, what that indicates, and how do we know what's going on internally in the physiological process, and what we need to do to correct that. So the first aspect of Ashtavida Pariksha, or 8-fold examination, is the nadi, or the pulse examination, or the pulse diagnosis. So this tends to be a very important factor in examination of a patient as per Ayurveda. One thing we need to also remember is the fact that this is not just the only method of diagnosis or examination. The reason the acharyas or classical text or teachers of Ayurveda mention 8 factors for examination, it's because no one procedure can give you all the information you need to understand a disease. There are people who are very skilled and who have a lot of experience in using any one of these methods of diagnosis. However, for the most part, it would be better and more beneficial to use all 8 methods for diagnosis as opposed to concentrating on just 1 or 2. So what I think, or what I like to do, is actually use all 8, because I feel that you get a much clearer, better idea about what's happening in the person's body, which sometimes we may miss if we just use any 1 or 2 methods for diagnosis. Okay? So in Nadi Pariksha, or in examination of the pulse, there are certain factors that we need to look at. We need to first understand which dosha is predominant. In that, when you're looking at a pulse, you're actually getting the information about the dosha predominance at that particular point in time. With more experience, you may be able to find out which doshas were predominant in the morning, or were predominant in the evening or the day before. But for the most part, when you're examining a person's pulse, it's giving you information about which doshas is predominant at that particular time. If you were to check the person's pulse after 2 hours, that predominance of dosha may change. If you're checking the person on an empty stomach as opposed to after they've had a meal, there may be a change again in the pulse. So those subtle differences, you will gain information and understanding of this pulse diagnosis after a lot of experience. And there are indicators from the classical text that give us an idea about which disease exhibits certain different changes in the nadi. It's one of the factors that gives us information, but it's not the only factor that we need for examination of a patient. Okay, so we need to determine the predominance of doshas. So we know that if it's a vata nadi, it tends to be very sporadic. It moves like a snake. Whereas opposed to if it's a pitta type of nadi, it tends to move like a frog. It's very predominant. It sort of jumps out at you. It's very hot and very fast. And if it's a kaphaja nadi, it tends to be like a swan. It's very mild, very slow, but with a very specific rhythm. Okay, so we need to determine the dosha predominance for the nadi. We also need to look at the rate, how fast or how slow the pulse is. We also need to look at the rhythm, if it has a specific rhythm, if it is irregular. And we also need to look at the volume, the intensity or the amount of pressure that you feel when you're checking the nadi. Okay? So that's the nadi examination. And again, we'll go into detail about these things in the modules, and according to which disease condition we're looking at, it may vary. The next is the mala examination, or determining the different changes in stool. Again, this is a really important factor, and in Ayurveda, and usually in an Ayurvedic consultancy, we tend to ask a lot of information about a person's stool. Some patients may not necessarily always find it important, but we know that this is a direct correlation with how the digestive system is working, how the person's agni is working, how their koshta is working. So being able to examine a person's stool is very important in an Ayurvedic examination. So we need to look at, when we ask questions about the person's stool or about their ability to pass motion, we need to first ask them about the color. So there are certain things that sometimes in the first consultation you may not always get full information about, but you need to educate your client or patient about noticing these changes and differences. So for instance, the color of the stool, the consistency, sometimes the color may change according to doshas. If the color is very dark, it usually indicates there's a vata predominance. If it is very light, like a pale colorish, it tends to be more of a kapha predominance. If it's more yellowy, it tends to be more of a pitta predominance. And we need to look at the consistency. In a vata predominant consistency, it tends to be more hard, more rough. They find a lot of difficulty in passing motion. It tends to be very infrequent, and also it may be prolonged from one evacuation to the next. In the case of pitta, it tends to be more frequent. In fact, they may have more amount of bowel evacuations per day as opposed to the other two doshas. It tends to be more loose, sometimes may have foul odor, and also, again, the color will be different. For kapha, it tends to be more well-formed. It tends to be very a regular frequency. So for instance, it may be once a day, but it's always once a day at a very specific time in that day. And there's usually more amount of, they feel satisfied, they feel cleansed, they don't feel that heaviness feeling afterwards after passing of motion. And also, again, the frequency that changes according to dosha. So that gives us an idea which dosha predominance is there, and also gives us an idea about their ability to digest the food that they're taking in. If the digestion is good, then the output would also be good, and the frequency will also be regular. If the digestion process is impaired, then again there will be changes in the waste product evacuation. Okay? The next examination, or next biological factor that we look at is mutra, or urine. And that's also, again, important. It gives us an idea about the fluid balance in the body. we need to look at the color, frequency of urination, the volume, the odor, and also urgency. So for instance, in the color, again here, a pitta urination tends to be more of a deep yellow color. Also, if the pitta predominance is more, if it's imbalanced and it's in the Vidha avastha, there is more heat in the body. So that's why the urine tends to be much more of a bright yellow color or a darker tinge of yellow as opposed to the other two doshas. For Vata, it can be light, it can vary, it can be light, it can also be dark depending on where the imbalance may be. And for Kapha, it tends to be more of a sort of a pale yellow urine. With Vata, there tends to be sometimes it may be frothy. And again, we'll talk about this when we get to that module where we're looking at the urinary system. We again need to look at the frequency. So we know that there are disease conditions where the frequency of urination will be more, such as in diabetes. So the frequency and the volume may differ, and that's also important for us to understand. If the frequency is more, it may indicate that there is an imbalance in the fluid consumption or either the fluid retention in the body. And that, again, we need to find out where that pathology has started from and what are the appropriate treatment measures for that. And in some cases, there may even be odor in urine as well. So that, again, we need to, according to the odor, sometimes if there is ama that has trickled down into the urinary tract or in the udaka vahashrotas, then you may get that change in the color or the odor of the urine. It may have somewhat of a foul smell, which is not a normal smell for urine. Okay? Or sometimes there is a sweet smell. In classical texts, they mention that for a diabetes patient, their urine will have a sweet odor because there is so much amount of lack of sugar metabolism, so therefore their urine will tend to have a sweet odor. Okay, it's also an examination of that urine is you would collect the urine sample and leave it at the windowsill and see if ants if they flock towards that urine sample, that means it has a higher sugar quantity, it has that sweet smell, and that's why ants will go to that. That's one of the classical tests to see if a person has diabetes. Okay? So in urine, we look at these different factors. We look at, again, at urgency. So for instance, sometimes if we know that Vata is responsible for the initiation of urges, of natural urges, such as urination. So if Vata imbalance is there, if Vata is very increased and it has localized in the urinary bladder, the person will feel the urgency to pass urine. Sometimes the quantity of urine may not really correlate with the amount of urgency that they feel. Their bladder is actually not very full, but they feel that they need to pass urine, so they go to urinate, but the quantity is very less. So that really indicates that the Vata has increased so much that it's actually the Vata that wants to escape, but not necessarily the quantity of urine that's pressing down on the bladder that's initiating the urge for them to urinate. Okay? So the color, frequency, volume, odor, and urgency. These are some of the factors that we look at in urine examination. So the next aspect of examination is jihwa, or the tongue diagnosis. And this is another unique aspect in Ayurveda that we look at. The tongue is a representation, it gives us an idea of different organs in the body, and we can understand if there is a normal functioning or an abnormality according to the variation in the consistency, in the different colors and shapes, and even cracks, other changes that we see in the tongue can indicate if there's an issue with a specific system or a specific organ in the body. Okay, so when we're looking at tongue diagnosis, we look first for the shape of the tongue. That can indicate, again, according to Prakriti, whether it's Vata, Pitta, or Kapha, whether it's a thin, long, or a sort of very sort of fleshy and very red, or a very thick, very round tongue. So that can give us an idea as to their Prakriti, as well as if there's variation in the shape, such as bumps, or cracks, or even elevations, certain swellings, that again indicates various pathologies. I'm sure that you've gone over this in some of your earlier training as well. And then we will talk about this in more detail in the modules when it's corresponding with a specific disease condition. Okay. We also look at coding in the tongue because this gives us a really clear idea as to the digestive system. It gives us an idea about Agni and if the food that the person is ingesting is being digested, assimilated properly, or if there is indigestion or ama present. So a very easy common way to understand if ama is there is that there will be a thick white coating at the root of the tongue, and the more chronic the ama is, the more it moves towards the tip of the tongue. It also indicates if there is a foul smell or it's a different coloration. It indicates how chronic the ama is. The coating can be actually thicker. The more chronic it is, it can change from a whitish coloration to almost a yellow, sort of old, opaque, creamish color. That again indicates that it's very chronic. If there are cracks in that coating, again indicates even more chronic ama, and also that would also be an indication of where the digestive system had a part to play in that particular pathology. So we look for, again, coating, the presence of ama, cracks, coloration, and shape. These are the major factors that we look at in the tongue for tongue diagnosis. The next aspect is shabda, which actually means sound. So we're looking at shabda in speech, the person's speech. This is why when you're examining a client or patient, it's really good that you get a chance to talk directly with them. If it happens that you can't see them in person, but you really need to get a very clear idea about how they interact or how they speak with you and how they react to certain questions. Because in the intake process, we ask many questions. Some topics can be sensitive, but their reaction to these questions really give you an idea as to what is very sensitive to them, what is really bothering them, or if there are things that it's very easy and it's not really a huge issue. So being able to speak to your patient or client and being able to actually hear their responses, the shabda, from them gives us a lot of information as to where their state of health is at. Okay, so in shabda we look at the tone of voice. We also look at the rate at which they speak. So we know that in a person who is of vata prakriti or vata condition or even a vata derangement, they tend to speak very fast. It's very irregular, and sometimes irrelevant speech. So for instance, they'll start speaking about one topic and then it goes off to somewhere else and then it ends up at a third topic and then they forget what they were talking about in the first place. That's a typical sort of vata speech, but it also gives us a really clear idea as to, again, what is the predominant dosha at that particular point in time, and a little bit of an idea as to their mental status as well, how they react to certain things. So that speech is really important for us to understand. The shabda. Shabda here also means if there are other sounds that's coming from the body. So for instance, if you were to check for joint pain and you find that the person produces sound when they're walking, which is actually a sign and symptom of osteoarthritis or even certain types of rheumatoid arthritis, in Ayurveda where it is astigata vata. Astigata vata means vata that is situated in the asti dhatu, or vata that is situated in the joints. When the person walks, it produces sound. So that's one of the signs and symptoms. So we need to look and find if there are certain sounds that are coming from the body. So that's that crackling sound when they're walking or when they're flexing their joints. There's also that gurgling sound. There can be sounds from the abdomen. That gurgling sound is also important for us to understand if that's present or not. That indicates, again, vata being in the abdomen, in the stomach area, which is not its own domain. It's in another domain, in the pitta domain, and it's moving around there. So that can be that gurgling sound that you get in the stomach. Not because of hunger, but because of other pathologies. That indicates, again, a vata condition. If there is sound that's produced that when we do palpitation and we find if there are sounds in different types of water retention, that again, these are things that we look at for the density of something. We were able to figure that out by examining sound. Okay, so any type of sound, including speech, is looked at in the Shabda examination. The next aspect is sparsha. Sparsha means to touch. So here we're looking at the temperature of the client. We're touching them and looking at their sparsha, their touch, the temperature of the body. We also look at sparsha in, for instance, in the skin. If we're palpating and we find that there are certain lumps, or even if it's a lump, if it's a hard lump, if it's soft, if it's movable. These are things that we look at in sparsha, not just by our sparsha, but how their touch or how it feels when we touch them. Also, we look at sensitivity. So for instance, if they have pain, and if it's pain on touch, that's another indicator of severity of pain. So these are things that we look at in sparsha examination. Next after that is drik, which means the eyes. We examine the eyes, and in that we look for the color of the eyes. So for instance, if there's discoloration, if it's very opaque, or if there's redness in the eyes. We also look at the luster of the eyes, if they tend to be very, very bright, or if it's very dull, or if it's sort of glassy. These are again indicators of different dosha imbalances. If they have any sort of gritty feeling or any dryness in the eyes, again indicates different dosha imbalances. So we need to also examine the eyes. Remember, the eyes it's an organ that contains both the kapha elements in the physical structure of the eye, as well as the fire element, which helps in the physiological functioning of the eye. So it has a subtle balances in how it carries out its normal functions, and also indicates the normal functioning of the representative doshas in the rest of the body as well. So that's why examining the eyes gives us a lot of information. So the next aspect is akriti, or the physique, and we need to look at the physical structure of the person. This indicates not just their build, but it also indicates sometimes the amount of strength that they have, their physical strength, as well as their stamina, their ability to withstand different types of work and different types of abilities to be able to go on. So in that, we sometimes it can be difficult to understand a person's physique and relate it to doshas by just seeing the person as opposed to asking questions about it as well. It can be an easy area to misunderstand, but by using all the other information that we've collected from the other forms of diagnosis, it gives us a clear idea as to where the doshas are at, if there is an imbalance, and if this has a part to play in the disease condition that they may have. So for instance, if there is a vata derangement, if it has been very chronic, naturally the dhatus tend to be depleted, and that can also cause a person to seem very thin or to seem very lean. Now sometimes if we look at a person and we see them lean, we think, oh well, they're healthy, they must be exercising, or they must have a very healthy lifestyle, that's why they're thin. But even in just looking thin, sometimes there may be a pathology that's causing the person to be thin, as opposed to doing the healthy habits and factors that would cause a person to maintain a healthy, normal weight. So examining of physique or examining of akriti is, again, very important for us to understand the difference between a normal, healthy state and an abnormal state that has been caused because of an imbalance of doshas and because of a vikriti. So now that we've gone through the different methods of examination, we now have the tools to understand what information we need to collect on the first sitting when we see a client or patient. And then also these are the same factors that we're going to go through again when there's a follow-up. So after you've seen a person for the first time, you collect all of these basic information. It gives us an idea again about the disease state, the condition, the variation of the doshas, the dhatus, the agni, and all other factors in the person's environment. And after they have started the intervention, whatever you have prescribed or you've advised, then in the follow-up, we again recheck all of these factors to see where it has changed, and if it has improved or if it has declined or stayed at status quo from what it originally was. So these examinations actually make up the major portion of a client intake from the Ayurvedic perspective. We'll go into more detail about this for each and every module and with its corresponding disease condition.